I went to the doctor to get a cap or a bridge done on my teeth, and now there is food getting stuck between my gums and between my teeth. Should I blame the doctor for that? Today's episode is all about that. Let's start. So today's episode is kind of very close to my heart, as I receive a lot of feedback from patients about food lodgement secondary to any sort of prosthetic caps or bridge work done in their teeth. Now, a lot of times patients generally tend to point it at the dentist's direction, saying that it was the dentist's fault, that whatever that they made has led to a lot of food lodgement and basically has deteriorated my oral health and gum health around that area. If I have to be completely honest, that's not the case. Why? Because this may sound a little off coming from me, but it's very simple. We cannot mimic what God has made. As simple as that. I cannot put it more simply like that. We cannot mimic exactly what God has naturally made in our tooth, in our whatever face or whatever it is. So whenever you have any sort of a situation where there is breakdown of the tooth substance in the form of fracture or decay or a missing tooth because of periodontitis or gum disease, and you're planning to go for a prosthetic rehabilitation in the form of caps, crowns or bridges, there is a very high likely chance that there will be a problem associated, such as food lodgement in that area, because of the fact that tissues are very dynamic. At the same time, if the decay or the fracture or any sort of problem has gone unnoticed or uncatered to for a very long time, the gums around that area change. There is obviously a little bit of structural change in the bone as well. I'm talking about ears and ears altogether. And you have to understand that no matter how good or how precise or skilled the dentist might be, they might be having the best lab work for their prosthesis, there is a high likely chance that it's not going to be the exact same way how the tooth were designed to be in the natural form. Also, going on to the basics, it's very simple. If the teeth are actually very convex in size and shape, so that when you eat your food and you digest it partially while gnashing and chewing onto the teeth, it should go through the crevices and whatever areas down into your throat so that it can get digested in the stomach. However, when this anatomy is disturbed due to decay, fracture or any sort of other problems, you don't get that exact thing and food starts to collect. Now, if it's been not catered to for a very long time, the bone loss can happen. At the same time, your gums can get inflamed. But also, as I said, no matter what we do, we cannot exactly replicate. We can probably reach a margin of 90-95%, but not 100% anytime. So I'm telling you, this is a very arbitrary statistic that I'm giving you. In more than 90%, at least I've seen in my practice, in more than 90% of the cases, if you're getting a cap or a bridge work done, there's a high likely chance that area will have food lodgement. So what to do in such a case? First of all, no need to blame the doctor. It's as simple as that. You have to make sure that whatever you are eating, you are maintaining that area properly. And it's your doctor's job to tell and re-educate you all the time that if there is a cap there, you have to make sure that there might be a chance of food lodgement. And you have to take extra precaution and care to make sure that area of adjusting to the cap or the bridge work is kept clean and hygienic. You can either use floss or interdental brushes or water floss or all these things. Please contact your doctor regarding the same and make sure that the area is kept clean. Again, I'm saying we cannot mimic what God made. We can just try our best to make sure that it is as close as possible to the natural form. So this was today's episode. Please like, share, subscribe, and don't forget to press the bell icon for important updates. If you want to do a WhatsApp consultation with me, here is my WhatsApp number along with my social media handles, so that we can have a chat, and maybe whatever I can do to the best of my ability, I can probably answer your questions, apprehensions, and any sort of queries. So this was today's episode. Have a nice day.